Oh, hello. This is Naomi. I have getting a lot of calls and a lot of texts and a lot of questions on Instagram and Facebook. Naomi, can you please give me an idea what to do before and after the surgery? What medications can I take? Cannot take? Even though they're not having surgeries with me at Seduction with Dr. McAdoo and or doctors, they're having surgeries with other doctors. The information is basically the same. It's the same protocol to follow for the BVO, but you always have to ask your doctor what to do before and what to do after. Remember, every doctor has a different protocol and have different aftercare surgery protocol and before protocol. So always ask your doctor or the nurse or the coordinator. I am not a doctor. I'm just a coordinator, and I'm just like you guys. And I have learned doing this. I'm learned this during the past 14 years by doing a lot of surgeries with the doctor and coordinating a lot of surgeries and dealing with a lot of patients. And I have a lot of patients that love me and they follow me and they always call me and ask me if this is what they should do. Now, number one, before surgery, I always suggest patients 4 weeks before surgery always to go to their doctor and make sure they have a checkup. They check their CBC, make sure their hemoglobin is in 12, and make sure there's no infections. Do not take any drugs, do not take no aspirin, do not take birth control, and do not drink alcohol at least 4 weeks before surgery. Please make sure you don't do any drugs, no aspirin, no medication that has aspirin, no diet medications, no phentamine, no any Herbalife diet. Like basically 4 weeks before surgery, you have to be able to be in great conditions to be able to have a surgery. Now, what other patients ask me, can I smoke? Try not to smoke at least 2 or 3 weeks before surgery. It's better 4 weeks before surgery. That way the healing process is a lot more better, and you will heal a lot more better. What other questions that patients ask me? If they come out of state, I always recommend them to buy cranberry pills. You can buy those out of the counter. That's just to prevent a UTI. We also recommend Floradix. That's to put your hemoglobin level up. So follow the instructions. It's out of the counter. Anyone could buy them, and ask your doctor if you could take them or not. Always ask your doctor. Remember, avoid aspirin or any medication that has aspirin or ibuprofen before the surgery. No diet medication, no vitamin E, no birth control prior 4 weeks before surgery. That's something that you should all know about. Now, 1 week prior to the surgery, do not drink alcohol and do not do any drugs, please. This would interfere with any anesthesia problems, and you can have a lot of bad problems after the surgery. If you're coming out of state, please try to come with somebody. If you don't come with somebody, stay at any recovery home that any doctor will recommend for you to stay, or maybe the facility has a recovery house. But it's very important that you have someone with you, or that you're staying in a place that they're going to take care of you. What happens the night before the surgery? Do not drink anything after 12 o'clock p.m. midnight, or ask your coordinator what time is your surgery. You have to be empty stomach 8 hours prior your 24 hours prior your surgery. 24 hours prior your surgery. Do not wear contact lens, do not wear glasses, do not bring your eyeglasses to the office. Make sure you don't bring any bodily properties or wear any fancy clothes or fancy shoes. Just bring comfortable clothes, regular shoes, no accessories, a bag that has your name and other medications with you. What are you going to be prescribed? You most likely doctors prescribe antibiotics, pain medication, and nausea medication. Other doctors, they do prescribe Lovenoil injections. Just ask your doctor, because some of the doctors require that. Always see your doctor the day before the surgery, so when you do the pre-op, they give you all explanations reference to the surgery. Please always remember to ask your doctor everything about this. What happens after the surgery? You must come to see your doctor the day after the surgery. You most likely will have a drainage. The drainage will be removed in 7 days. This is another video. I will be recording more videos to give you more information about BBL. Thank you. Bye-bye.